Okay, now the second part, it's just to talk about clinical cases and how I do this technique. I want to introduce my very first clinical case about injection technique. That is a young lady. She already finished the orthodontic treatment 2 weeks ago after she came to the visit. You can see that the gingival margins are okay, but not the incisal edges. Also, you can see the upper lateral right incisor. It's not okay. She has all composite veneer, and she wants something bleach and very predictable. So at that point, I just finished my master program, and I not feel super confident to do a hand uh, and to do a freehand restoration. So what I decided is to do a injection technique. So this is the initial situation. You can see this lateral. First of all, I remove all the composite veneer here, and I did a wax up. I did a wax up in a conventional way with my hands just to try the mouth to see if the patient looks nice and if she like it. She like it, okay, and that's the point. She like and loves the wax up, so I need to copy that. So that's the reason why I do this injection technique under relative escalation to improve the shape and the color of these teeth. You can see the before and after, how we improve the color. First, that is the first question of the patient, demand of the patient, and also we improve the shape of the teeth. You can see the before and after. It's not a huge improvement, but for the patient it was. Sorry, and without touching the teeth, that it's super important. Also that. Another case is this one, that is a old lady that she has a lot of restorations, a lot of stuff in the mouth, and she wants to do something in the anterior because she feels that are not the same as before, but she doesn't want to do ceramic veneers. She wants to keep as much as enamel as possible. So what I did long time ago is the same technique. I do the injection technique one by one and try to improve mainly here the shape. The patient don't want to improve the color, it's mainly the shape. You can see the 1.1 and the 2.1 are not symmetrical, and once I finish the injection, that's the result. You can see that it looks very good. No, I mean, it's a single appointment, very effective restorations and very convenient restorations. So I always want to show you this case because you can see what happens during the years. This is the control after 1 year. The surface is not glossy anymore. It's completely flat and not textured at all. So what we need to do in that point is to do a small repolishing. Always that you repolish, you always remove some kind of material and some layer of material. This is after 3 years. Okay, after 3 years you can see this material completely disappear, and this is 4 years and a half more or less. All the marginal integrity of the restorations are lost, but the patient at that point get retired and she wants to wait a little bit more till 5 years and to do it again, the restorations. Yeah. So at that point we recheck, and the good thing is that the teeth under the restorations are completely perfect, not problem at all. So what I need to do to repeat is just to remove the old restorations and to do a new ones. I want to show you this sequence because I think it's important to know what happens with the things after the years, during the years. You can see that it's good. I mean, this is the normal period of time that I explain to the patient, that is between 5 and 6 years, just to do a rechange of the restorations. Okay, so 5 years, it's time to redo it. And at that point, we redo the mockup using the old silicone guide. We redo the mockup trying to improve a little bit the color, but the patient wants the B1, she doesn't want a bleach color. So at that point, I need just to remove everything. You can see this sound enamel, completely sound enamel. And in the gingival area, I apply some Teflon inside to avoid the bleeding in this area. After all, I start doing one by one teeth, and this is the final, the same day. That day I spent a lot of time polishing. Why? Because I think it's crucial, this polishing, to achieve a good gingival stability. And also she has anesthesia in that day, so it's easier for me to do it in that day. I normally use for this gingival aspect this contra-angle that is oscillating tip that you can polish the margins of this area. 30 days after doing the restorations, you can appreciate the gingival aspect and it's going back normal. And this is the result 1 year, almost and a half after doing the restorations. You can see that it's not the perfect case, but it's very resolutive and simple case. And for me, the most important thing is this, the gingival aspect of this patient. So, to conclude my presentation, I think that for this technique, as for almost all the techniques, choosing the right case it's key, because if not, even you have the best material, you are gonna fail. Also, I think that I show you a lot of tips regarding the material selection, and I think it's very important to select properly these materials to avoid and to um, have less problems. And also this is related with little details. Small details makes big difference. You can see that choosing properly the silicone, choosing properly the consistency of the restorative material is gonna be easier for you for the ending of the case. Also, this technique offers a reliable and straightforward treatment alternative because it's very convenient, faster to apply, and it's not something super difficult that you cannot do it. You can do it in the very beginning in your your career because it's easier. And we comment, it's this treatment or alternative treatment a low quality treatment? I don't think so, because what is quality in dentistry for you? It's a good crown that has been in mouth for 3 years, or it's a crown that has been in mouth for 35 years. So we need to redefine the quality. And for me, the quality is not just the final picture. You can see these guides to measure the quality in dentistry, and they talk about 6 points because, yeah, if we obtain a good result, it's very effective result, it's fine, it's perfect, but it's patient centered, it's safe, it's efficient. I don't think so. We always try to reach the 10, but sometimes this 10 it's in the height of the in the top of the mountain that we cannot uh, obtain. And if we try to do a complex techniques, complex materials, we are not gonna reach this 10. So what we want is to simplify the process, improve the process, but not reducing the quality. Okay, just to all of us try to obtain the best result, that is the 10, just not compromising the quality of the treatment. So that's the main reason and the main rule of this philosophy is the keep it simple, just to apply that. And this is something that was described by Sir Kelly Johnson in the 60s. That's all from my part. I share my Instagram account. I share this QR with a lot of articles talking about this technique. And thank you so much for the opportunity to present for you guys. I wish you, really really wish you the best in these hard days. I can imagine the suffer that you are feeling, and the life that you have right now. I have two kids, and I really can imagine how hard it has to be, like a parent and like a person living there. So I really really wish you the best for this journeys and dentistry, and I wish you actually the best in your life.